Hey. On today's episode of Hanging Outside the Coop, we have Dr. Gregory Jean-Pierre. I'm really excited about this because I'm going to be special guest host for Shana today. She's actually behind the camera, so she's going to get a little feel. Yep, there you go. Hey, Shana.
Hey, everybody.
I'm really, really excited. I've known Dr. Jean-Pierre for many years now, but this is the first time I'm actually coming in as a patient. So, Dr. Jean-Pierre, tell us what you specialize in.
Well, first of all, thank you so much. I'm so excited to be the guest today. I've watched pretty much all of them, so this is definitely an honor. Well, again, I am a chiropractor, but I'm not the traditional chiropractic. As many of you know, I specialize in something called NUCCA. NUCCA stands for the National Upper Cervical Chiropractic Association. So what I specialize in is adjusting the atlas, which is the top on the spine, and by doing that, as you're going to see throughout the day, we are able to focus on the nervous system itself in a unique way without having to pop, twist, crack, or anything like that.
Hey guys,
Yeah, we have guests coming back.
Lots of pictures coming
It's
in.
live, so it's all right.
It's only Facebook.
Yay.
So, all right, let's come on in. Oh, the first thing I noticed here is Mr. Tony Robbins, like one of my biggest heroes and mentors.
Yes.
So, he's come here?
Well, Tony Robbins has been here, and he had referred me a couple patients as well. Again, if you understand him and what he talks about, it's all about posture. So he referred me a couple patients that he's worked with that are, that were depressed. And one of the key category when somebody's depressed is how they hold themselves. So he recognized that, and by getting the NUCCA correction, we're able to get everything back, because he talks about how physiology can determine everything. Okay, so if you look at somebody that's depressed, their physiology is like that. If you look at somebody that's happy, their physiology is like this. So a lot of time, the emotion can be caused by the physiology. So by fixing the physiology along with some other things that he does, he's able to get everybody back over the hump. So that's one of my mentors as well. So
we're in good company over here.
Absolutely, yes.
Awesome. So before we started here, we did an examination where we did some x-rays and a bunch of series of tests. And one of the things that we did right before we started filming live is we grabbed some water. Now, you guys don't have just any water. Tell me a little bit about the water you have.
Well, again, it's all about health. Everything that you do, everything that you do should be towards health. So the water that we have, and a lot of people already know, is Kangen water. So it's a little bit alkaline. We have 9.5, and it's actually to be able to help your cell regenerate and your cell to stay alive. A lot of the things that we have in our water that we drink daily, there's so much junk in there that we don't know. Even with the plastic bottle, there was a research that showed that so many of the stuff that we actually drinking are plastic and all these chemicals that are actually literally killing you. So why not? Your body's 80% water. Why not get something that's pure, something that's going to aid you in your healing? So I have the machine at home, and I bring it here every 2-3 days. I fill it up, and it's Kangen water, 9.5 I have. But you can actually, even the food that you drink, if you actually rinse that, the chemical that's on it comes off, and you are able to eat clean and drink clean, which is really, really important.
You were telling me beforehand that Tom Brady has this at his house,
Yeah.
and Tom Brady's like my biggest hero,
Yes.
so wow.
Yeah, if you look at his latest documentary, you can see in his kitchen, he has the machine, and that's what he uses. So some of the top athletes are using it, so why not? If it's good enough for them, I'm going to use it myself. So
On his Facebook Live one, it's Tom versus Time.
Yes, exactly, yeah.
So awesome. Beforehand, we did the examination, we did film it, and we'll show some of the scenes from that examination in the Rooster Coop.
Yeah. So I can talk about the examination process. So again, when you come in, I have no idea whether I can help you or not. So there's a very extensive evaluation that we do to determine whether you get a good candidate for what we do or not. And some of the tests, we do a partial evaluation because, as I mentioned before, posture is actually the number one thing that dictates your health. Okay. So if somebody can come here and say they're perfectly healthy, no pain, no disease, they're studying like this, that can't be possible. If you understand the spine is the highway of life, so when your spine is twisted and crooked, which means the brain is not able to communicate 100%, which can cause pain, symptoms, and disease. So we evaluate your posture, we look at the alignment of your feet, we look at the nervous system, making sure that the brain is communicating through the body without any interference. We look at range of motion, looking at restriction, we're looking at the internal organs, and then we take a series of very specific x-rays to determine what's going on with the atlas. And we just did all these things with Michael here, and he was impressed. So and then we go over the results on the next day to really determine whether this is a good candidate, you're a good candidate for what we do. And if you are, then we can take great care of you and you'll be over the hump really quick.
I'm a little excited, a little bit nervous to find out the results.
Do you want to go over the results, or do you want to? Perfect. Actually, let me grab this. This is Michael. So you can let's go right in here and I'll go over the results with you because this really gonna make sense.
This is live.
It's live.
There's people here at the doctor's office, which makes perfect sense. It's Friday.
You can have a seat right here. We'll just go over some other things. So when I say posture is the most important thing, this is what I mean. If you look at your spine, you're supposed to have these natural curves here. So therefore, when your curve is perfectly aligned, the brain is able to communicate at 100%. All these nerves comes alive and able to communicate with the rest of the body. So if somebody's standing like this, what's happening is really the spine is all twisted and crooked, and so you can see over time there's going to be pressure on some of these nerves. All these nerves goes to your blood vessels, organs, and glands, muscles. So pressure is not allowed the proper communication. Over time, that can actually create pain, symptoms, disease, and stuff like that. So the first thing that we do with Michael is look at his posture. And I don't know if you can actually even see that, and we'll post some of the results. But again, when somebody's standing up straight, that green line, the eyes, shoulders, rib cage, pelvis should all be in one line. When you're standing on the side, your ears, shoulders, pelvis, knee, and ankle should all be in one line. So this kind of calculates the deviation, what's going on, and it tells you where your head is shifted, where's your shoulder, where's your rib cage. When we had you on the scale, you were carrying about 5 pounds more on the right, and you had a short leg of about half an inch shorter on the right. Also, this is the most important thing. Look at the head.
Looks forward.
Yeah, the normal human head usually weighs 8 to 14 pounds. So based on your height and weight, it's estimated that your head weighs 12.5 pounds. However, because it's moving forward like that, it's actually weighing 26.6 pounds. Okay, let me make this is a cool example. Let me make this real for you. This is 8 pounds. Your head weighs 12 pounds. What I want you to do for me is to grab this ball and hold it just like that. Right? I mean, you're pretty strong, so it's not a big deal, right? Now keep it here and just slightly bring it forward. Now, does that ball feel a lot heavier than when it was there?
Oh, I could do this all day.
Yes.
Here?
Right.
Yeah.
But the weight of the ball didn't change. It's still the 8 pound, but it feels heavier because biomechanically it's not in balance and in proper position. So when your head is in perfect position over the shoulder and hip, it feels normal. There's a normal weight being distributed. All the nerves are working properly. But a slightly shift just like that, all of a sudden now it feels like you're going to fall. The pelvis has to rotate. And a lot of you, if you were to go back and touch here and touch here, it's probably sore. There's a lot of knots. There's a lot of muscle tension there. And the reason for that is it's trying to keep your head from falling back. So those muscles, no matter how many massages you get, if you don't actually fix this issue, these always going to be tight. It's always going to be spastic because, again, that's the normal body reaction to be able to hold that head. So over time, you're going to create a lot of muscle spasm. And worst of all, if you kept this position for years and years, what the body's going to do is actually going to start fusing the muscles. Fusing the bones, which is why when you see these little old ladies in this position, and not only that, they're not able to turn their head because everything's fused because they've been in that position for so long. So posture is one of the key things to actually evaluate health and make sure that everything's working at 100%. Yeah.
Now, when I look at this, I'm thinking of all the time I spent on the phone, all the time I spent on the laptop, driving. Like, I just feel like all those things I do
and
too much.
That's one of the things that we educate people on, because posture, it is the everyday things that you do that creates that memory. Nowadays, I've seen a lot of kids that already have what we call text neck because they spend so much time texting, and now you see people falling down holes because they're walking, but this is doing a greater problem because it's creating a lot of arthritis here. People that spend 8 hours a day at a computer weren't designed to do these things. So you had a computer 8 hours a day is not being active, your posture is being affected, and over time you get neck pain and back pain. Even in your car seat nowadays, they have the seat tilted forward because it allows you to prevent whiplash if you're ever in an accident. But what it's doing is keeping you in that position, so you're developing chronic neck pain without knowing it because it's like that. People sleep on their stomach, or you sleep on your side. Like if you sleep on your stomach, unless you have a hole in your bed, you're really like this. If I were to ask you to do this for 5 minutes, your neck would actually be in spasm within 5 minutes. But when we're sleeping, we don't feel that, but that twist is actually creating a lot of degeneration. Now think about it. If you sleep 8 hours a day, by the time you're 45, that's 15 years of sleeping. 15 years. Now, if you do anything for 15 years, what do you think is going to happen to that nervous system in that spine? So if there's one thing you take out of this, posture, posture, posture. And the great thing about Rooster is we have a lot of yoga teachers, we have the posture police. We have so many resources that there's no excuse that I should be coming to any of the events and seeing people like this, or it's like I'm gonna be watching you. So make sure you get the proper posture, make sure you're sleeping properly, make sure that everything that you do, because this is the first indication whether you're healthy or not. So posture is key.
You mentioned sleeping. Like, how do you recommend people sleep? You said not on your stomach. What about your side or your back?
Well, again, the side is okay, but a lot of time we get these fancy pillows that actually put us in the wrong position. When you sleep on your side, you don't want your head to be tilted because the pillow's too soft, or you don't want your head to be tilted the opposite side because the pillow's too big. You want a pillow that's the distance between your shoulder and your head, that when you sleep everything stays aligned, but you can have it slight tilt. Now, even though side sleeping is good, the problem with it is, there's research that shows that when you sleep on your side, everything is rested, but this side is actually supporting you, so you're not really resting on that side. Over time, if you sleep on one side all the time, you're going to start having shoulder issues, which might lead to surgery and later on. And also your hip, you should have a pillow in between your legs. So the absolute best way to sleep, if you can, is to sleep on your back. Okay, you need a cervical pillow that's going to support the neck to allow the head to fall back. So it's just like we talk about the curve, and you need a wedge. A pillow's not enough. You really need to elevate the feet, because when you sleep on your back, the pelvis actually rotates, which actually a lot of people is not comfortable sleeping on their back because of that, but also that can give you some back pain. So elevate it. Again, it doesn't seem like sexy or the way you sleep, but it's not about that. Everything that you do, you need to be moving towards health. So if you can find the proper posture to sleep in, that can be key in actually getting healthy. So
all right, so I learned how to sleep, I learned how to posture, I got a lot of homework to do.
Learn what to drink. Yeah.
Sure. All right, so we're going to go into the exam room?
Absolutely. Let's go to... Follow me. So this is our examination room and x-ray room. Before any visit, we do a complete evaluation of the nervous system, which I just did for you. It's actually on the screen, and I printed it for you so we can go over it if you guys are interested. And then we take a very specific x-rays to be able to determine what's going on, okay? And we also did that, and we can go over the results. But more importantly, if you want to come this way and show them these things, because that kind of sums up everything that we do. That yellow bone, that's the atlas. The red area is the brainstem. Now, the brainstem is important because that's what coordinates everything, all function. Every signal coming from the brain has to get through there, and every signal coming from the body has to go through there. And guess where it is? It's between the skull and the atlas. So any rotational deviation of the atlas, and when I told you guys this, you found it funny. Atlas means Greek mythology holds the world. So the atlas is literally holding your world, which is your brain. So when the atlas goes out of position from here to here, it compresses the brainstem, doesn't allow the proper communication to take place. But look at the position of the head. So when you talk about posture, your head tilt to one side, which we're showing on your result, that can put tremendous amount of pressure on that brainstem. Now, a lot of people suffer from migraine and headaches. That itself can be the big component of it, but also people suffer from high blood pressure. Look at the vertebral artery and how much tension it is. That's going to increase blood pressure in the entire body, which causes high blood pressure, which, once you start taking high blood pressure medication, you have to take it for the rest of your life because it's not fixing anything. It's just mimicking the numbers. Now, the longer in this position, the more these symptoms you start developing. Okay. Nowadays, we can focus all day long on these symptoms because you have drugs, lotion, potion, surgical intervention. But as we know, you can never take enough aspirin, so to speak, for a headache and not have it. And it's probably going to happen tomorrow because the aspirin doesn't take care of the headache. So what we do is focus on bringing everything back here, and when that happens, the body's able to naturally heal itself over time. Okay, so we determine all these things based on the scans, and then the x-rays tell me the exact location of the atlas and how we are able to actually bring everything back into position.
So I've been to chiropractors before because of car accidents and different injuries, especially I play a lot of sports, but you do something different. This whole examination was different, and talk to me, like, is this what everybody's doing now, or you specialize in something that other chiropractors don't?
Right, and again, chiropractic, the premise of chiropractic is to actually balance the nervous system. Now, traditional chiropractic are more focused on somewhat symptom-based in the natural realm. So instead of giving you drugs, lotion, potion, they examine the spine, just like I said. If there's, like, let's say, there's a twist in the low back, then the goal is to pop it back into place. If there's a twist up here, the goal is to pop it back into place, which is great. There's absolutely nothing wrong with that. Now, what we focus on, what we specialize in is only the atlas, because based on biomechanics and physics, force always travels to the path of least resistance. So even if I were to punch you in your back, yeah, you're gonna have pain in your back, but that force has to travel somewhere. It won't travel down, so to speak, because you have the wide hip. It's gonna go up because the atlas is a 2-ounce bone, it's the smallest bone, so that's gonna get misaligned, and everything follows that. So when that misaligned, everything follows that. So the goal is, because the brainstem actually sits there, if that's out of position, it's literally put pressure on the brainstem and can affect everything as a whole. So everything that we do is to see whether this atlas is in proper position in relationship to the head and the rest of the spine. And if it isn't, we are able to calculate the exact formula to be able to bring it back into place. And the adjustment, literally, if you were to put 2 fingers here to actually feel your pulse, the amount of pressure that you put here, that's the amount of pressure that it takes to adjust the atlas. It has to be very precise and very delicate because of all the neurology that's happening in the brainstem. So yes, there's only 350 of us that specialize in this. And again, sometimes I do the examination. I tell people, well, you don't need my level of expertise. You just need to go to a traditional chiropractor, which is absolutely fine. But when we see a more advanced case, then we do a trial of care to make sure that you're going to respond, and then by gently adjusting that, and over time the body responds really quickly to allow the brain to regain communication with the rest of the body.
So what inspired you to specialize in this type of chiropractic?
Well, a lot of you know my background. I'm an athletic trainer, sports medicine. So I was interested in learning more about chiropractic and sports. So really, I wanted to work with athletes. So when I went to chiropractic school instead of orthopedic, the medical school, one of my good friend, and Tim, hopefully you're watching, his brother, they invited me out to go for a few drinks, and I'm like, I can't go because I have a migraine. And he's like, oh, you should see my brother. He can fix you. I'm like, what did your brother do? I was excited. And he's like, oh, he's a chiropractor. I'm like, oh. Okay, but keep in mind, at that point, I've already seen neurologists and specialists, and there was nothing wrong with me because everything was negative, but I was still suffering with these migraines. So when he said chiropractor, I'm like, whatever, and I'm sure some of you have the same idea when it comes to chiropractic. But again, he convinced me. I went, and I can remember specifically, he was the very first person to tell me, I found your problem. Now, keep in mind, I didn't believe a word that he was saying, but the fact that he said he found it, I'm like, okay, tell me more. And after the same examination process that we went through, he told me that my atlas was rotated and it was putting pressure on my brainstem. It was going to adjust me, and I'm like, yeah, okay, do it. And after the first adjustment, I felt nothing, but I kept going because he was a nice guy, and it's like, but it took me 2.5 months to actually feel some changes, and then I started questioning. I was like, what did you do? Like, how is it that you are able to give me relief where nothing else is? And I started asking questions and digging in, and to find out that, and most of the time when I help people, their first reaction is that they get mad. It's like, and I felt the same way. It's like, why did I have to suffer for 20 years? Why didn't anybody tell me about this? It's frustrating. So when I went through that phase and started questioning, asking more questions, at that point it's like, you know what? If this can help me, there's thousands and thousands of people that are suffering from headaches and migraines. If I can help one of them, I've done my job, which is why I switched from doing sports chiropractic to now I've never actually adjusted anything other than the atlas, because this is the key. And even though my focus is migraine headaches, I've seen people recover from sciatica just by adjusting here. I had one young lady here yesterday. She's a belly dancer, and she had to stop dancing because her foot was hurting. I never touched the foot, I just here, and that was able to heal. I have people with high blood pressure, MS, trigeminal neuralgia. This actually able to, again, I want to be clear, I don't fix anybody. I never cure anybody. The only thing I do is put the body back into proper position so the body is able to heal itself. Each and every one of us has the perfect ability to heal itself. It's just when there's interference, by removing the interference, the body heals. By removing toxin, by removing anything that's like I said, you're either growing towards health, you're going towards disease. You got to make that choice. Everything that you do on a daily basis has to be towards health. Otherwise, you're not going to have it. If you don't take care of yourself, nobody will. So yeah, that's the main thing.
You told me once that you're the geek squad for people who suffer from migraines,
Yes.
and I'll never forget that. I thought that was awesome.
I went to a Tony Robbins seminar. Like I said, he's my mentor, and one of the things that he says, you have to come up with a quick thing for people to remember you. Okay, and if you use like a national brand like Nike, just do it. Like, you know, if you can use that and then put it towards what you do, then it'll stick to people. So I came up with and actually one of my friend Tim, we actually talked about it and came up with it, being the Geek Squad of migraine. Everybody know what Geek Squad is for the computers, but that's what I do here. When you come in, just like you notice, it was like very geeky. All these X-rays to figure out what's going on, all these scans, all these numbers to actually figure out what's going on, and then all this thing, I still haven't adjusted you yet. And when I put you down on the table, the adjustment feels even weirder because I have you lay on your side and I'm doing all these position, all these measurements, and I'm adjusting you and I'm huffing and puffing and doing the adjustment. All in the meantime, you're sitting there like, what's going on? Because you're not really feeling anything. So it just was the perfect term for me, just a geek squad of migraine. So if you have migraine out there, give me a call.
He's your guy. Yes. Actually, so Dr. Jean-Pierre is always looking really sharp. He has a tie on, but he wears a tie not just because it looks good, but it actually serves a real purpose. Tell us
Yes.
about that.
Well, the purpose is, again, the adjustment is, there's a lot of technical aspect to it, and of course, we do classes here to teach you, but in doing the adjustment, I'm not actually pushing, I'm actually pulling. So based on the x-rays, and we can actually take a look at the x-rays, we come up with a coordinate. There are 10,000 different ways that the atlas can misalign. And there's only one way, just like a fingerprint, that we can actually fix it. So we have to be very precise. So let's say with your atlas, I found that it was tilted up, and it was rotated back. So I need to put the exact amount of force and vector to be able to do that. So in my positioning, I'm able to measure exactly where everything is, and then be able to position it directly here, because the force that I'm actually adjusting is actually coming from what we call the episternal notch, which is here. So it's all about here. So yeah, this serves dual purpose. Yeah, it looks good, but also it actually aids in the adjustment as well.
Well, I'm really excited. So we're going to review my results and then do an adjustment, right?
Oh, we can do that, absolutely, yes. I didn't mark your x-rays yet, but we can actually take a look at it quickly. This is your the x-ray that we took from the top. Can you see this here? See that little hole?
Mm-hmm.
So, I mean, we take life for granted. That little hole that you see, that tiny little thing, this is literally where the brain exits to become the spinal cord. So it's not that big. It's this little tiny hole, but everything happens here. Now, you remember Christopher Reeves when he had his accident?
Yes.
The only thing that he did, he went off the horse and fell head first and fractured the back of the atlas. This is your atlas. He fractured that. Okay? That was it. But yet his legs wasn't working, he wasn't breathing, nothing else was working. So that's the importance of having this thing in power position, because any deviation from that is actually detrimental, because the brain cannot communicate. So just like we talked about the posture there, you're supposed to have that nice curve here. You can see how your head is actually tilted forward.
Well, straight, yeah.
So it actually shows up on here. So that after a while, we take the x-ray again, we want it to be able to do that. Now, this does take a while. So what I'll do is I can demonstrate the adjustment.
Okay.
Because it takes a while for me to analyze it. I'll demonstrate the adjustment. I want to actually adjust you, and then we're done here. I'll analyze it and actually give you a real adjustment. Okay.
Stay tuned.
So follow me. So. The adjustment process. So first, I would have you lay down on your back.
Okay.
So in order to determine whether the atlas is in and out, I would have to take x-rays every single time to be able to do that, and really that's not really any good idea. So the body has this mechanism that when the atlas is off, you have what's called a neurological short leg, and we explained that earlier, that when the atlas is off, all the power muscles get tight, and that actually move everything off center. So every time you come in, rather than take x-rays, we're going to measure the legs. So today, if I measure your legs, and we did that earlier, we saw that your right leg was about a half an inch shorter than the left. If I measure it and it's off, then I know, okay, we need to adjust you. Okay. Now, if I measure it today and it's perfectly even, then there's nothing to do. Everything is where it needs to be. If everything is balanced, then there's no point of adjusting. And the goal here is, the more I don't adjust you, the better your body's actually responding. So unlike traditional chiropractic, I don't want to adjust you every time. I want to actually adjust you less and less, because that's mean your body's holding the correction. It's not the adjustment that fixes you, it's maintaining the correction that fixes you.
That makes sense.
So let's actually take a look. And we already did this, and I don't know if you actually can even pick that up. You would have to be right on top, but you can see the right leg here is actually really short. And you can actually see that, really short. So again, we're gonna pretend to do this because I haven't actually looked at your x-rays yet. So at this point, I would actually either have you lay on your right or on your left. Okay? So that would be determined on the x-rays. So you can lay on whichever side you choose. And based on the x-rays, which usually are on the computer here, I'll fix you accordingly here.
Don't try this at home.
Yeah, don't do that. All right, fix the shoulder. And everything that I would be doing here would be according to coordinates that I found on the x-rays. And we have these little trusty rulers here. Look at the alignment. So this is where I was talking about the tie. So let's say this would be his misalignment here. So position myself accordingly here. And that. I'm not going to touch it, but this would be kind of mimicking the adjustment to be able to adjust the atlas, okay? And I mean, it takes just a few seconds to a minute, but by doing that, we would position the atlas, and that would be able to get everything back in proper position. And I would have you lay on your back again, and at that point, we'll check the legs, and the legs would actually be even. Okay, so again, the adjustment is not scary, like most people think I'm gonna, twist you, karate chop your neck or anything like that. None of that. It's very gentle, very precise, and by doing that, and we monitor throughout the entire time. On the 12 visits, we take x-rays, we do the scan, so it's not you just telling me that you're good, but we can actually determine that on every step to be able to determine that, oh yeah, objectively you are getting better. So it's very different.
I respect and appreciate the fact that you won't do an adjustment until you actually thoroughly review the x-rays.
Right. And again, you gotta understand, we are dealing with the atlas. This is like the most sensitive region in your body. I know a lot of people, they come in and they want to get adjusted right away. I never do that because you don't want me to guess. And if I didn't take my time to actually do that, I would actually be guessing. And just like the adjustment can help tremendously get your body better, it can actually hurt if it's done wrong. So you have to be precise, and that's kind of one of the things I pride myself in doing. Always make sure that we do it right, because again, this is your health that we're talking about. So yeah.
Awesome. So, well, thank you so much.
Oh,
this is
sure.
my first time here as a patient. I'm really excited to get the final results here at the Upper Cervical Institute. And how long have you guys been here in Boca Raton?
In November, it's going to be 5 years. I actually practiced in New York for 7, and then I have 2 little babies. I wanted to come back home. So this November 20th, going to be 5 years since we've been here in this location.
And he's going to throw a big party, and everyone in Facebook out here,
Yes,
they're invited.
absolutely.
Right?
Yes, I am. Yes.
All right, well, stay tuned. We're going to be showing the behind the scenes, and we'll also give you an inside look at what we did with the examination beforehand. So stay tuned.